For delayed puberty in boys. We can divide this into two key categories. One is primary delay, and the other one is secondary delay. Primary delayed is going to be any sort of problem with your gonads. Okay. Secondary delayed puberty is any sort of problem with the brain. Okay. So primary delay means any sort of problem with the gonads. So what can that be? Klinefelter syndrome. Secondary hypogonadism or delayed puberty, it's going to be any sort of problem with the brain. So constitutional delay, we're going to come back to that. Chronic illnesses, malnutrition, hypothyroidism, hyperprolactinemia. Recall, guys, that prolactin, it decreases GnRH, so therefore we can get delayed puberty over there. Kalman syndrome, again, it's going to be decrease on a GnRH. Craniopharyngioma, that's also a tumor of the pituitary in children, and that can also lead to delayed puberty. Clinical features: absent testicular enlargement by age 14, delayed growth spurt, and initial workup: FSH, LH, testosterone, TSH, prolactin, bone age, and radiographs. Now let's come into this really important one over here, which is going to be constitutional delay syndrome. So constitutional delay in growth and puberty is a condition in which children experience delayed puberty compared to their peers of similar age, associated with delayed and pubertal growth spurts. Let's come to this table, and I got an NBME number 10 question on this constitutional delay of growth and puberty. So we can see clinical features is going to be of late bloomers. So this is going to be delayed puberty, short stature, normal growth velocity, and delayed bone age. Management is going to be reassurance, watchful waiting, and hormone therapy. Prognosis: so puberty onset correlates with family members and normal expected adult height. If you want to do constitutional delay of growth and puberty, we have three main categories. One, it runs in the family. Okay. Two, there is going to be a sexual delay. And three is that there's going to be delay in the bone age. I'll repeat that for you guys. One, it's in the family. Two, there's going to be some sort of problem with the sexual reproductive system. And three, the bone age is going to be low. Okay, bone age, short stature. We have NBME number 10 question here. A 12-year-old male, 18 kg per meter squared, 10 percentile for height, and 5 percentile for weight. He's an avid soccer player. Tanner stage 1 at 12 years old. 1. X-ray is of the bone is 10 years and 6 months. What's the diagnosis? So guys, over here they didn't give us any family, but it could have been, they could have mentioned the family. So that's the first criteria, family. Second is going to be like we can see sexual or hypogonadism. We see here Tanner stage 1. So two criteria he more or less meets. Third is bone age. So his bone age is going to be quite delayed. So three categories he meets. People can confuse with nutrition today. Look, nutrition today, the bone age will not be affected that much. He will not have Tanner stage 1. Like that's and they said he's active. You know, he's a football player. That's unlikely. Okay. If psychosocial concerns are severe, or if puberty is significantly delayed, short-term testosterone therapy in boys or estrogen therapy in girls should be considered. Pharmacotherapy, however, should be considered in boys above 14 and girls above 12. Boys, to be honest, they take their time to reach puberty, so we give them some time, 14. Girls reach puberty pretty quick. They start around 8 years old. They start 8, boys start 9 puberty, so they are a little bit earlier on. Circumcisions, there are some health benefits for this. It decreases the amount of UTIs in the first year of life. Prevention of pathological phimosis, which basically means the foreskin kind of constricts and prevents retraction, and reduction in penile cancer, and likely due to reduction in phimosis, which is a risk factor. Reduction in certain penile inflammatory diseases, blanditis. Reduction in the risk of STIs, for example, human papillomavirus, HIV, penile vaginal sex, especially in countries where HIV is endemic. Drugs, GnRH agonists are not recommended. for adolescents due to decreased mineral density caused by prolonged use. Okay, guys, I want to speak to you guys about recap everything. We have primary delete in puberty, delay puberty in boys. That's Klinefelter syndrome. That's it. Secondary is a brain problem. Okay, Kalman, craniopharyngioma, any sort of nutrition problems, hypothyroidism, hyperprolactinemia. Okay, just look at for hormones. How to investigate the patient? Look at FSH, look at LH, look at testosterone, look at all the hormones. Okay, this is important. Constitutional delay in growth in puberty. I said 3 categories we need to have: family history, bone age delayed. Last one is going to be hypogonadism. So the testes may not be developed. Tanner stage 1. That's what we need. Other points not too high. I won't be recapping those, but just keep those 3 points in mind, and I'm sure you're gonna ace any question on that. Thank you guys for watching. Hope to see you guys next time.